the bridge between community and campus. And your role is really to make sure that people in the university side are engaging with community in a responsible manner, meeting needs that the community actually wants, not just a project someone just thinks of. It's a lot of that intentionality that we discussed earlier, where you have to kind of listen to your partner, and then kind of go to the other side with your university partners and say, okay, the school was really looking for this. And really helping your partner navigate universities, because it's not intuitive to people that work in nonprofits. Who do I talk to in a university if I just want to bring students to a sporting event? Or, how do I do that? So it's a lot of like playing matchmaker. You kind of become a jack of all trades on issues. So, the project ideas can be some health related, but some arts, criminal justice. It was all over the place in terms of discipline. So you also kind of, get to play in a lot of different spaces, which I thought was really exciting, but still helping to make these larger scale partnerships.
To Public Health Careers, I'm your host, Omari Richards, founder of the Public Health Millennial. We're going to dive deep into public health topics and career journeys. You'll hear diverse career stories, absorb professional development and career strategies, get tips, while also learning from others to help you in your own journey and learning of public health. Learn about the vast world of public health careers, or just hear public health stories. Stay tuned so we can do our part towards a culture of health, well-being, and equity. Welcome to episode 121. Hi everyone, Omari Richards here. Thank you all so much for joining me again. Or if this is your first time, welcome. Thank you for joining, and I hope that you enjoy the show. Be sure to follow me on Instagram at the PH Millennial to keep updated with all this information, and subscribe to the podcast and share it with a friend. Today, I really enjoyed the conversation. I really enjoyed how it went from her wanting to pursue environmental science from being in high school, getting a degree, a bachelor's and master's level, and then kind of pivoting into more of community campus partnerships. And I think it's important how she highlights the work that she's done and how you can take the skill sets that you have and apply that to different realms of public health, as well as don't box yourself in because there's just so many opportunities. Enjoy. Today, we have someone working in the community university partnership space. She got her Bachelor's of Arts in Environmental Studies from Washington College. She then got her Master of Science in Natural Resources and Environment with a focus on environmental justice from the University of Michigan, Ann Arbor, and worked for a few years before pursuing and getting her Doctor of Public Health at Morgan State University. She works as the Executive Director for Center for Community Service and Justice and the York Road Initiative at Loyola University of Maryland. We have Dr. Gia Grier McGinnis, DrPH MS. Welcome to the show.
Thanks for having me.
It is my pleasure. It is my pleasure. I didn't think I'd have difficulty in saying Loyola.
Loyola, yeah. Yep.
But so it goes. How are you doing?
I'm doing well. How about yourself?
I'm doing well as well. Been a busy day, a busy Monday, but happy to be doing the good work that I get to do. So I cannot complain. So tell me, how have you been during the pandemic and what it has become now for us and like just everyday life?
Yeah, so like a lot of people, the lockdown period of the pandemic was difficult, just trying to be in my home and confined and not being able to see people and have that interaction. So it's been nice, especially working on a college campus. This is like the first semester that kind of campus life is back to kind of quote unquote normal, with being physically present on campus and going into the office more than not. So it's been nice to see a campus environment come alive again.
Yeah, I can imagine. I couldn't imagine what a campus life would be like during the pandemic, and I do not envy the students or the professors and other administrators that had to work during that time, because it's very, very unusual, that's for sure.
Mm-hmm.
So how do you identify, and tell us a little bit about your personal background?
Yeah, so I am a Black cisgendered female. She, her, hers are my pronouns. And I'm born and raised in Baltimore City. grew up here, I work here now. Really from an early age enjoyed environmental things, and enjoyed urban nature. So going to parks in Baltimore City, got really involved in that kind of stuff, informal programs for young people. So, really credit both my family for exposing me to just parks, getting me out to like the average park that's up the street and in my city, for some of the interests I have now even.
Yeah, that sounds like very interesting from a very young age. So what were those type of engagements that you did with organizations, I guess, before you got into the formal or academic realm of environmental science?
Yeah. So there are two things I did in my high school years that were sponsored by nonprofits, and then one was university focused. So the aquarium here in Baltimore City has a program called the Henry Hall Scholars Program, and it exposes high school youth to marine science careers. So I got to go to Key West for a week as a young person, and then they let you stay involved with them through summer employment opportunities. The other thing was actually offered by a university I ended up working for later. And it was a program offered by the University of Maryland School of Nursing. It was called the Environmental Justice Youth Corps. So it was like a small number of us from Baltimore City high schools that were actually given an opportunity to do outreach programs in our community, like talk to people along the harbor about the dangers of eating fish. We put on a conference. It was kind of like very cool. But those programs really was what kickstarted my interest in the environmental field, because it's not common for like Black females to be like, oh, I want to be an environmental scientist. Like, that program at University of Maryland kind of exposed me to like a Black female toxicologist and a Black female environmental attorney. So it was good role modeling for myself. And that's what actually led me to go to Washington College in a rural environment and get an environmental studies degree.
Okay, that's amazing, and I'm glad that you mentioned this. And just to see how it plays out into your role and how you thought about going into university. And I guess I don't interview too many people with the environmental science background, but when you do look into it, yes, there are a lot of Black leaders, Black women leaders that have been part of the environmental justice movement and have led a lot of that work. And before we get into more of your schooling around environmental studies, what does public health mean to you? Break from our show sponsor. Have you been interested in connecting with a community of people who are passionate about community health while working on improving their own personal well-being? Well, lucky for you, the Community Health and Wellness Discord server is where you want to be. It's a free online community I co-created just for people like you. You'll find friendly people talking about important public and personal health topics, asking amazing questions, sharing valuable information, while connecting with each other to build a better culture of well-being personally and at the community level. Join this free online community by going to thephmillennial.com/join. That's thephmillennial.com/join. See you there. Now back. So
Public health to me is basically helping to solve health and well-being problems, but to scale. So how do we have a larger scale impact on some of these pressing social issues? So not really like one person at a time, but how do we think about these things in a bigger picture and really thinking about it systematically?
I think that is key, and the scale is important because I think that's the perspective that a lot of us going into undergrad, it's like, okay, we want to help people, and the lens that you know how to help people is through that individual lens because that's what you see in society. But then you realize that there's this broader scheme, more scaled up scheme of public health that is really focused on population level health
Yep.
and really like not only promoting but preventing disease, which I think is cool. So I appreciate that definition. And then going into your story, so you got your Bachelor of Arts in Environmental Studies at Washington College. So what was the thought process going in there? Granted, you just stated that you had like these programs that you were a part of in high school.
Yeah. And so when I started the college process of looking into different colleges, I ended up at Washington College, which is a small liberal arts rural college on the Eastern Shore of Maryland. It's not very different than Baltimore City. But I went because they had a special scholarship program for Baltimore City and PG Cal youth. But also the Eastern Shore of Maryland is just beautiful. There, it's the Chesapeake Bay, which, there are lots of beaches, marshes. It was just a great living laboratory to learn about the environment. And so I thought it would be cool. I get to go out on boats, I get to go into marshes. So it was definitely a hands-on experience of how to learn about the field.
Absolutely, absolutely, and that makes sense coming from the experience that you had as a high schooler, and then wanting to do this in college. And I think to that point, it's so important to get the exposure and get into doing types of things that might interest you in career fields. And one time I remember that I was in Maryland. I can't remember where in Maryland specifically, but there were ponies on the beach.
Yeah, Assateague Island. Yep.
Yes, yes. And they attacked us and took our marshmallows. They ate all our marshmallows.
Yeah, they can be aggressive. They're not afraid of people because so many people go through there. Yeah.
Yeah, that was a very interesting experience. I did not expect it whatsoever. Okay. And then with your Bachelor's of Arts in Environmental Studies, were there any, and just like your experience during undergrad, were there any big takeaways or other things that you think would be important to share?
I think at undergraduate level, you're still trying to be exposed to a lot of different things. So the other thing that I did while I was at Washington College was I traveled. So they had a special funding program where you could write a grant and they would send you wherever you wanted as long as you came back and reported out to this honor society I was in. So I got to go to Cuba, I got to go to Ecuador, I got to go to Alaska. And so at undergrad level, I feel like it's explore, just do as much as you can to learn about as much as you can. Even though you are asked to pick a major at that level, just the extracurricular experiences you can have can also give you skills beyond your actual degree program.
Yeah, those extracurricular activities are definitely a formidable way to gain experience and gain like exposure to the field as well. And that's really cool that you're able to travel to all those places. I feel like a lot of places that people want to go to but never go to. And I'm glad that you got to go to Alaska. I used to live there for 14 months. So
Oh wow, yeah, it's different.
it is quite different, and it's quite different in the summertime than it is in the wintertime as well. Okay, so after you graduated, you became an AmeriCorps Vista, and you were part of the Student Environmental Leadership Development Program Manager at the Children's Environmental Health Network. So how do you come across this AmeriCorps Vista position?
Right. So while I was in undergrad, I was also involved with like community service. And as I was graduating, my advisor told me about AmeriCorps Vista, which is a national service program for people that want to volunteer for a year but receive a living stipend from the federal government. And you're usually placed with a nonprofit partner. And as a Vista, your job is to be a capacity builder for a particular program or project. And so my placement was with the Children's Environmental Health Network to run a program that's funded by the EPA Region 3 at the time, called the Student Environmental Development Program, which was an environmental health education program for DC middle school youth. And so, of course, it was kind of a give back moment for me. So a program like that was what helped me. That's why I was drawn to the opportunity. And I also wanted to take a year off. So, after 4 years of undergrad, I knew I wanted to go to graduate school, but definitely wanted to take that year off and work and not go right into a grad program.
That makes a lot of sense. And I think it's a good viewpoint for people coming out to the bachelor's programs to not rush into it, especially considering that it's just more schooling and more schooling, which could be stressful in itself. So I think it's important to also realize like where you are and be aware of, okay, I have the capacity to do it now, or I need to take a break and do this type of work and get valuable experience, which you did. Do you think that you were effective in building capacity of this organization as an undergrad coming into this position?
I think so, because you really almost act like a program coordinator. So it was myself and one other AmeriCorps member that was placed there, and we pretty much ran the program. So there was, the executive director and the associate director that were there to give us guidance, but they kind of trusted the program and the day-to-day operations. They left that up to us. So it's very much, even though it's a volunteer position, you do function very much like a full-time staff person in these Vista roles.
Okay. And you stated just prior that coming out of undergrad, you had the idea of wanting to go to pursue like a master's level degree. So coming out of undergrad, did you know what you particularly wanted to study, or was that something that you gained more insight while you were doing the experiences in Medical Vista to make that final decision?
So I think even like going into undergrad, because I had the environmental interest and I still did as I was leaving, I was thinking about looking into grant programs that were also environmental. It was just a matter of where. And so in my search of grant programs, it kind of narrowed down to, 4 or 5 that I applied to, and University of Michigan in Ann Arbor was one of them.
Okay. And when you would, like, I guess to make this helpful to other people as well, when you were narrowing down to schools, what were those kind of key things that you were looking for when you were looking at programs?
So I knew I wanted to do environmental justice. So my undergraduate degree was kind of generic environmental issues. So I took classes like marine biology and conservation, but I was really interested in like the human health side of the environment. And so I knew I had to hone in on programs that offered environmental justice programs, which back in that day, I won't tell you what year that was. Back in that day, they were actually harder to find. Now I think it's much more common to find social justice oriented graduate programs. But back then, it was a short list of universities that offered environmental justice programs at grad level. And Ann Arbor's program was one of the original ones in the country. And so when I got into that program, it was really an awesome thing. And I was really looking forward to going.
Yeah, I appreciate those insights. So you got your Masters of Science in Natural Resource and Environment at the University of Michigan, Ann Arbor. Did you have a concentration, and what was the deciding factor if you did have one?
So they had a formal environmental justice track. So in addition to the core classes, they had some other classes they recommended. And also the program was flexible in terms of your electives. So this is where I started taking public health classes as electives. So air quality and water quality were offered through the public health school. And so as I was taking like courses on women and the environment for environmental justice, I was also taking classes in the public health school about kind of these human health related issues related to the environment.
And to that point, when did you learn about public health? Because I think it's a lot easier for us as in a young age to understand environmental health and environmental
Mhm.
justice and these kinds of issues. But public health is still kind of in a gray area, at least for most of us growing up. So was it the experience in this master's program that showed you what public health was, or did you have prior experiences that you realized what public health was?
So actually at the Children's Environmental Health Network, there, the associate director at the time, who's now the ED there, had a public health degree. She had actually gone to GW's public health school in DC. And so it was like, oh, okay, she has a public health degree. Okay, so like I can also get a public health degree.
Okay, awesome. I love to hear that because that is in many ways, well, one of the few ways that I hear many people share that they found out about public health is like
Mhm.
they're doing this experience, and then either a student or a professional that they're working with has an MPH or is working towards an MPH, and they learn about
Yeah.
it that way. So that's awesome to hear. And during your time during your master's program, you were a research assistant for the Minority Environmental Leadership Development Initiative at the University of Michigan. So tell me a little bit about that experience.
Right. So the advisor that I was paired with when I came into Michigan was Dr. Dorceta Taylor, who actually she's now at Yale School of Forestry, but at the time she was at Michigan, and she had a lab um, that was doing research on people of color in the environmental field. And at the time she was running a study where we were on her behalf contacting environmental NGOs and kind of just asking them a survey about, inclusion statistics and just, their thoughts on inclusion in the environment. And then, doing all the coding and all the stuff that the faculty member doesn't have time to do, you're doing that. And then she also had a website that featured people of color in the environmental field on this website. So I would also contact environmental professionals of color and interview them about their careers so that we could feature it on the website.
Okay, that is helpful. And in understanding like your story, and so you have your bachelor's in environmental studies, then you went on to get a master's in natural resources and environment. Did you have an idea of what types of roles or positions you would be doing once you graduated with your master's?
Right. So back then, I really thought I would graduate from my master's program and be kind of an environmental justice activist and work for like Sierra Club or like Wildlife Fund, like I thought I would have a more traditional nonprofit environmental path upon graduation because I had all these degrees and like experiences that are environmentally focused. So that was the original goal, was to kind of be a nonprofit professional.
Okay, that makes sense, and I think that's like a traditional thought process because that's what you know about or what's shown most to you. Um, and were there any other takeaways that you had during your master's program?
So my master's program was where so part of my research for my master's program was working with communities in Detroit and Dearborn, Michigan around a transportation project that they were trying to fight. They were trying to prevent the expansion of it. And that was the first time that I really saw grassroots level organizing in urban contexts and the work that it took on the ground to kind of mobilize community around a particular issue or topic from a professional standpoint. Because what I did in high school was just kind of like projects they let the young people do. But this was like, watching people whose full-time jobs were doing this organizing work. And I thought it was really fascinating.
Yeah, what was most striking in looking and seeing what those grassroots organizers were doing for these types of initiatives and outreach events?
That it just took coalition building, like meetings just to get people on the same page about the issue of concern, making sure lots of different populations were listened to, because everyone had a particular reason why they wanted to prevent the expansion. They were dealing across cultures. So there was an Arab immigrant community and a Latinx community that was sitting where this project was. And so it took so much energy and effort and time and intentionality. It's not like, let's just like have a coalition. Like it takes a lot of work to do this kind of organizing.
Yeah, and I think people don't understand that. Then that's a lot of the work in public health is like getting all the stakeholders together and then building trust. And then when there are
Hmm.
missteps, resolving those missteps and moving
Yeah.
forward with trust, which does take a lot of effort and time and coordination. So like I can see why you like saw those things as important. And then after you graduated with your Masters of Science, you became a public outreach specialist at Tetra Tech. So how do you come across this and what do you do in this position?
Yeah. So, the dream was to be a nonprofit professional, but, and I went on interviews and all that, but I couldn't really land a job in that industry. So time was running short. I needed a job. And just by chance, I applied to a for-profit company. So Tetra Tech it still exists. It's a global water resources engineering firm. So this is the private sector. And Tetra Tech, they have federal government clients, also sometimes state level clients. And this branch of Tetra Tech had an outreach division, which basically translates scientific information for clients into consumable products for the public. So websites, technical brochures, federal public meetings where they need to get input from stakeholders. So things like that, which was not what I expected to be doing. And it's for profit. So like, I'm doing billable hours as a consultant, I have clients, it is just very different than the work that I thought I was going to be doing. So I did that for about 2 years.
Okay, that's fascinating, especially in the sense that there was more likely that you're more likely to get hired by a private organization than a nonprofit. Like I would have definitely thought it would have been the other way around. But regardless, I think you probably gained some valuable skills there, and working in this field that you didn't even think about, like just broaden your horizon and your scope of the work in and what you could do. But then after this role, you became the assistant director for the Johns Hopkins Center for Social Concern. So tell me a little bit about how you come across that and what you do in there.
So this is 2007. And again, like if someone told me I'd have a career in higher education, I would be really surprised because I thought I was going to be the environmental justice community organizer. But so I'm at Tetra Tech for 2 years, and that job had a lot of travel to it because the clients would be up and down watersheds. So I might be in New Orleans, 1 month, I might be in New York or Minneapolis. And I had a child, and just life and just the travel schedule was too much. And I needed a job that kept me in Baltimore, and a job where the hours were such where I wasn't, I could have a little more flexibility. And so, given that I had interest in community service as an undergraduate, I found this job at Johns Hopkins, which was not environmentally related, was not public health related. It was all about being a bridge between communities and the universities that sat in those communities. And so the Johns Hopkins office helped students and faculty connect with the community through a wide variety of ways. So I did that. I was there for 12 years.
Wow,
Yep.
wow. And that's very helpful. And I know during this time you also, well, during those 12 years, you began and got your DrPH, which we'll talk about a little bit later on. But tell me a little bit about more of that transition. So you said like it wasn't something that you were ideally shooting for, but just
Right.
logistically in your life, it made more sense. So how did you like ease into the transition into this new type of field?
Yeah, and I guess first of all, I told myself, "Oh, I'll just do this for 2 years and then I'll go back to environmental work." And then I think what happened was I just fell in love with a different industry, right? So, I was kind of laser light focused on the environment for many years, but, ended up in a role that, I ended up enjoying also. And so I ended up staying, and I was promoted halfway through my time there. But I still always kept that, environmental and health interest, which is why I eventually went back for the DrPH. Also working in higher education after my first 4 years or so, I realized that everyone that was director or senior level faculty had terminal degrees. So it was also like, oh, I need to go get something to advance in higher education. And I know that public health is a discipline that I would be passionate enough about to persist the many years that you need to persist through a doctoral program.
Yeah, that makes a lot of sense, and I like that perspective of like you coming into this new role, but you still like just knowing that you have the skill sets, regardless of not being like the field that you thought or the direct type of role that you would be in, but you still had useful skill sets that would make you someone that would be desirable to be an assistant
Mhm.
director, which isn't a position that's like likely chosen for. So that definitely makes a lot of sense. And then I think to the point of you also looking at, okay, I do enjoy this work in this field. What are the things that I have to do to set myself up for higher positions or greater
Yeah.
leadership or whatever the case might be, and seeing that it is a terminal degree. And that's a conversation I have with a lot of people, whether they currently getting their MPH or they're graduated and they're working and they're trying to think about advancements in their careers, but it's like,
Mhm.
you have to look at your career field and
Yep,
see what are the things that people in those leadership roles have, and how can you gain those skills to be competitive for those types of roles, which I think
yep.
is important. And during this time, you also got a certificate in risk sciences and public policy at Johns Hopkins Bloomberg School of
Right.
Public Health. So what was your thought process for this? Was this like your tiptoe into the DrPH public health more work, or tell me more about that?
Yeah, and some of it was just having access to more courses. So Morgan State's program, DrPH program, was a generalist degree program at the time, and so I just wanted access to more electives that were specialized. I also took advantage of my employer's tuition remission benefit because Johns Hopkins isn't cheap, but I work at Johns Hopkins. And so, most universities also offer tuition remission programs where you can take a certain number of credits for free. And so I took advantage of that. So I enrolled in a certificate program and used the tuition benefit every year to take a certain number of classes.
Yeah, that's very smart. And I think it's something that a lot of people don't know about, or they don't know that pathway to get reduced classes or certificates or whatever the case might be. But it is useful, especially if you're already in that position, to take advantage of those benefits that they do have for you. And so you said when in your process, because in this role you got promoted into interim director for civic engagement at the John Hopkins Center for Social Concern, and sometime in this you also started your Doctor of Public Health. So can you just give me like more of a timeline of when this happened?
Right. So, and actually, I was promoted to an associate director role after my assistant director role. So, about half of my time at that office, I was an assistant director. I was promoted into management. So, I was promoted amongst my peers to supervise a team of assistant directors after about 5 or 6 years. And then there was a director level transition above me at one point. And so, I was asked to serve in an interim capacity, which is just you kind of step in for a semester in this case until the next director is found, and that's really valuable. If someone ever asks you to be interim anything, just say yeah, right? Because it gives you director level experience. You can kind of prove like, yes, I can do a director level role. In the event you're ready to move into that, you can already say like, I've done that for a certain stretch.
Okay, I appreciate that, and that's helpful. So you shifted from the assistant director to associate director. What are the responsibilities and role changes that happened in that promotion?
So that was my first formal managerial position. And so, especially because I was promoted amongst people that I had formerly been kind of equal footing with structurally, um, definitely learned about, how do you manage people? How do you learn how people want to be recognized? How do you learn how to help people when they need to be coached performance wise? Hawkins offered these series of courses for managers. So I did that to understand like university policy, like HR. You start getting to know HR, you know. And so it was a good education as I began my managerial career of how do you manage people and coach people, so it stops being about your own performance per se. I mean, you do worry about your performance, but you're now also worried about the performance and future direction and growth of other people. And that's a big shift if you've never done that before.
Absolutely a big shift. And were there any steps you took outside of those courses to better, I guess, work as a leader and supervise different people, especially people that used to be your peers, which I think is
Right.
also interesting.
So I definitely reached out to other managers in my division, asking for advice, particularly people who have been at the university while I've been promoted. Um, and there are just other leadership development programs that the university offered. So again, a lot of times your employer might have these professional development programs that you can opt into. You just have to know how to find them and apply for them.
Okay, that makes sense. And then you're able to shift into the interim director position. what was the change in responsibility and roles, and how long were you in that position for?
So this was a semester, and so I went from having about 5 reports to about 12 because the director of the office themselves usually had a managerial load. So pretty much it was a flat organization. Like I was supervising a lot of people directly. So it was a lot of juggling in that stretch. I know right now people can relate to that with the great resignation. People are taking on extra work, juggling extra reports, maybe they don't usually have. So maybe everyone didn't get a one-on-one meeting every week. Maybe some people got it every other week. And you also just had to make sure that you maintained routine operations, because your job is to be a bridge between one leader to the next at director level. So you're trying to maintain operations as they normally function as close as possible, so that the next director can come in and not come into something that's disorganized or chaotic.
Yeah, and I'd imagine that you had to hit the ground running when you came into this interim director position. So if someone else is going to go into an interim director position where they have to hit the ground running, what are some of the things that you would give them advice or tell them that they should look over when getting into that type of position?
So your job is really to be a steady hand, right? Because change management is really important. People are scared when leadership happens. When leadership changes happen, people get nervous because, okay, what's going to happen next? Well, who's the next director? What are we going to do next? And your job in the interim stretch is to, make sure people are assured that like the next person coming in, you'll have a say on that, and make sure that people don't feel like things are like not in their control. Because some people are just scared of change, and so your job is to kind of make assurances that like change is coming, but like your job is to kind of keep people moving forward.
That's definitely helpful. And when you shifted into your roles at Johns Hopkins Center for Social Concern, as you shared earlier, your focus moved more from environmental justice to community campus partnerships. So can you just talk about the importance of having community campus partnerships, and what was there like one fundamental moment that made you say, okay, yes, this is something that I wanted to pursue and continue to work on?
Yeah. So, I mean, most universities have offices that serve as the bridge between community and campus. And your role is really to make sure that people in the university side are engaging with community in a responsible manner, meeting needs that the community actually wants, not just a project someone just thinks of. It's a lot of that intentionality that we discussed earlier, where you have to kind of listen to your partner, and then kind of go to the other side with your university partners and say, okay, the school was really looking for this. And really helping your partner navigate universities, because it's not intuitive to people that work in nonprofits. Who do I talk to in a university if I just want to bring students to a sporting event? Or how do I do that? So it's a lot of like playing matchmaker. You kind of become a jack of all trades on issues. So the project ideas can be some health related, but some arts, criminal justice. It was all over the place in terms of discipline. So you also kind of, get to play in a lot of different spaces, which I thought was really exciting, but still helping to make these larger scale partnerships happen.
Yeah, and I think that's indicative like of a lot of public health work, or like just a lot of public health themes in the work that you're doing. So I think it's important that you mentioned that, and not to say like I feel like in public health we oftentimes think about marginalized communities, but they're also uh, like college campuses, which are communities, and they're different like viewpoints of and perspectives on what a community is. And no matter what that community is, there are different ways to meet them where they're at, and to build the appropriate stakeholders to have that kind of coalition and understand how you can better improve whatever that might be, whether that's community connection or whatever it may be. So yeah, I think that's really cool. And I find it's just so interesting that like you had no intentions of going into this, but it is like literally what you're doing now.
Yeah.
And then also during this time at Johns Hopkins, you started your DrPH, your Doctor of Public Health at Morgan State University. So what made you decide to pursue a Doctor of Public Health?
Right. So this thought started back when I was at Michigan, because when I left that degree program, I had taken so many electives in public health and I really enjoyed it. And I regretted not staying an extra year. Like Michigan had the option of you could do a dual MS MPH program, but I was so ready to get out of school. I didn't stay the extra year for it. But I told myself, if I ever go back to school, I'm going to get a public health degree because I enjoyed those classes so much. So, there I was kind of in higher education and not knowing whether, I don't know how long I want to do this higher education work. So I don't want to get a higher ed degree and pigeonhole myself in the industry. So I have to think of a discipline that I would enjoy so much that I would be able to last for a long term in a long-term program. Because the doctoral program, I was in my doctoral program for 7 years. So it's not something that you pick something randomly or pick something like, oh, that sounds interesting. You really have to make sure you have a passion for it or you won't sustain yourself in the program.
Yeah, that makes a lot of sense. And so I'm guessing that you did it part-time.
So actually, the Morgan State program was designed for working professionals. So I did coursework full time. I went to class from 6 to 9 p.m. A few days a week for like the first 3 years or so I was in the program. And actually, because I didn't have the MPH going into the doctoral program, my first year I actually had to do a couple of MPH courses, and then they allowed me to matriculate into the DrPH program. But the courses were at night, so we were actually able to take classes full time,
Okay.
which was hard. Like it's hard. It's not for the faint, but it does, you're not in the program so long because you're not like doing part-time.
Yeah, that's my exact next like question. Like how did you balance all of this? Because you're doing like a lot of good work. You're going to school. You said that you have a child. I don't know if you had more children at that point in time, but so how are you balancing this during this time?
So the first year was definitely the hardest because I had not been in school for several years and had never been in school with a family. When I was in school the last time, I was a single person, didn't have a mortgage, didn't so I could just be a student. Now it's like, oh, I have a career, I have multiple kids because I got married, I had our two biological children, and then he already had two children that he had full custody of. So we had 4 children in the house when I started my DrPH program. So it was a lot that I'm not gonna lie and pretend like I had it all down first year. And then you just kind of, this is where the will and the desire to do the work comes in. Like if you do not have a passion for the work, you won't be able to push through. And so the days where it's like, oh, I'm gonna drop out, it's like, oh, but I love this work. So you definitely, it comes from within of just kind of telling yourself like, I can do this, I want this. I have to juggle, I have to like read things while I do things for the kids at the same time. So but it's definitely a test of motivation. Also, in addition to the skills that you need for your class.
Quick break from our show sponsor. Do you care about public health and health equity? Have you been looking for value-based apparel? Well, the Public Health Store has got you covered. Rock simple value-based design apparel that will surely have others interested in engaging in meaningful conversations with you. The Public Health Store has apparel for you to rock in class, around the office, or just casually around town. Wear your values where people can see them. visit the public health store at thephmillennial.com/shop. That's thephmillennial.com/shop. And use the code podcast for 10% off your next order. Okay, now back to you. Definitely passed that test, and kudos to you for being able to balance and get through everything there. And then, so your dissertation in your DrPH program was more around how universities and communities can work together. It was a community-based participatory research initiative between Morgan State and West and North Baltimore communities.
Mhm.
But I wanted to ask, going into your DrPH program, did you have a thought of what your research, well, your doctoral research would be around, or how did that come up for you?
I did. I originally wanted to do something environmentally themed. So I think I might have been interested in like climate change and health. But one of the things that happens is once you get into your program, you need to find an advisor that will help move your work forward. And at that time, there was just the person that I thought I would work with transitioned out of Morgan State pretty early in my time there. And so I had to kind of pivot and go, okay, what else do I want to do? Also knowing that this particular research study had funding from the National Institute of Health. So I knew that my sub-research project within their bigger study would be funded. And that's really important. I don't have to spend time writing grants. This is a lab that already has money. It's also community-based research, which I was really interested in. So it wasn't maybe the topic that I thought I would study, but the nature of the work being community and university partnership based, and the fact that it was a well-resourced lab played a big role in what I ended up doing for my research.
And that's a good point and great insights for anyone that is thinking about going into a doctoral program. Is like you need that person that's going to help and support and further your work with you. And to your point, like you wanted to do or had this idea of one person, and then they shifted out, but you were still able to gain access and work with someone that would be able to further your work, as well as be able to do more community focused work. Do you want to talk a little bit more about that research and what you learned from it?
Yeah, so Morgan State for many years, so over 10 years, had this communities engaged in advocating for smoke-free environments research study, which was a community-based participatory research study where they had a community advisory board, as well as a separate group where faculty met in the lab group to kind of keep the work going. And they had trained former smokers in the community how to administer quit smoking classes. And so it was really a peer driven model. And so my research was kind of piggybacked on this bigger study where I was looking at how do you motivate smokers to enroll in these courses? And it was basically by providing an educational intervention on the harmful impacts of carbon monoxide through a series of community outreach events. So we would table places, we would let people take a breathalyzer smoke test to measure carbon monoxide in their system. Some of them would get motivated to enroll in the courses that were already being done through the study. So it was kind of like feeding into the bigger project, which was how I was able to be funded through something that was already existing.
Okay, that makes a lot of sense. And I think peer learning and peer learning models are undervalued and not used enough, but they have a lot of great assets that you get with using peers and people that understand the experiences of other people that they're trying to support. As well as like shout out to you for making like work as easy as possible by hopping on the study and like to your point earlier, working with a lab that had grant funding, so you don't have to like use your time, not waste it, but use your time to search for funding and different things like that. And then coming down, like finishing your DrPH, what do you think are like the biggest things that you took away from that experience?
Yeah, so I mean, I think just the pride of making it out. It's so much more about yourself and your character and your ability to have drive and focus than the courses you take. I mean, it's about the courses and what you learn. but it's such a test of mettle that, if you can get your doctorate, you can do anything. You know what I mean? So it was really like, oh, I did that, like I did that. It was a very difficult journey, academically, but also like, social emotionally, because you are trying to do this juggle. So it was definitely like, oh, yeah, like I was able to accomplish this, and use this degree to hopefully impact my community further. So it was also just very exciting when I was done. It's like, okay, now I can like, I got all these letters. I'm not getting any more letters. Terminal degree. Like, no, no, that's not why. But that's, um, definitely the sense of accomplishment and the character building that comes with getting the doctorate.
Yeah, absolutely. And I think I think still at this point, the statistic is correct that I think it's like 2 to 3% of the US population has a doctoral degree. So you definitely are like far in the minority, and like kudos to you for being able to finish it. And I like the perspective that you're sharing on, it really is you having to persevere and push through, and not so much it being more of it being like a mental game than anything more than that, which I think is important. And I hope that other people also have like support systems and other things when they're going into these types of programs, because they can be tough, especially when you're doing it full time with the family and other obligations and responsibilities. So shout out to you once again. And then you graduated from your DrPH and you became an executive director for Cure Scholars Program, the President's Office, Greenbaum Comprehensive Cancer Center at the University of Maryland, Baltimore. So tell me more about how you come across this and what you did in it.
Yeah. So, because I was getting the DRPH, part of me was like, oh, shouldn't I use this public health degree that I just got? And so I started looking for a role that would help me leverage, all these degrees that I've gotten up until then. And so the Cure Scholars Program is a STEM and healthcare pipeline program for West Baltimore youth, where it's the students start as sixth graders and they stay in this program until they're seniors in high school. And the program provides them with STEM and healthcare mentors, after school programming, and STEM and healthcare related topics, summer internships as they get older. And then at the end, college and career support to actually help them with the college going process, since a lot of them are from first generation families. And so, again, it's another give back moment. Again, it's another program that's shaping young people to go into these career fields. Same university that trained me earlier as a high schooler. So I was definitely motivated by the, giving back part of it. It's a great program. It's NIH funded, and the president's office of the university, as well as the head of the cancer center for University of Maryland, had deep personal investment in the program. And so it was, it's great to work on that program. It was a little bit of a pivot for me working with the K-12 program full time, and as an executive director. So working from college students and then going to the K-12 population. But it was a very rewarding experience. Some of the scholars are now on the college campus that I'm at now. So it's like, I see them like, hey. So it's also really exciting to see some of them go on and be successful.
Yeah, absolutely. That full circle moment when like the impact of the work that you've done has helped someone get to where they are right now, and you get to see them doing great work as well, which is probably very, very fulfilling. Um, and in your current role, you're the executive director for the Center for Community Service and Justice and the York Road Initiative at Loyola University of Maryland. So how do you come across this role, and what do you do in it?
Right. So after a couple of years of working on this one program, I started missing the breadth. I started missing being that jack of all trades and having my hands in a lot of different projects, and programs. And so I started looking for a role that would kind of allow me to kind of be broader again. And Loyola had an open role. And the difference between the work I did at Hopkins and what I do at Loyola now is they had they have a program called the York Road Initiative, which is a community development program where we're focused on a series of neighborhoods that all border this 2-mile stretch of commercial corridor and along what's called York Road in North Baltimore. And so that was kind of a new feature to the work that I hadn't done before, what's more community development focused. And so our office runs a farmer's market, for example. We have a corner store food and nutrition program and some of the corner stores along York Road. We do stuff with youth, but that's in addition to the student facing and faculty facing program work that I had done before. So it was kind of adding on to a prior experience with something new that I hadn't done before, but still relying heavily on the skills I already had.
And that's perfect, because thinking about it, like as you said, you have the skills from the things that you had before, but coming into this role, this is that economic development, which is probably something that you had not much experience with in the past. But yet you were hired into the executive director role. So firstly, I want to ask, like, coming into this role, what were the type of things that you portrayed in your interview or throughout that process that you think kind of set you apart for them to say, yes, this is the right candidate that we want to hire?
So I think it's having the depth of experience working in university community engagement. It's kind of a niche field. So, not everyone has that kind of background. Some people come to these roles through the nonprofit sector, but, I've been working in this kind of industry for a long time. Paired with the fact that I'm from Baltimore, I think they found value that I'm from Baltimore City. So they did a national search, but they valued the fact that I have local knowledge. So I don't have to learn the city of Baltimore per se. I'm already familiar with it.
Okay, and that makes sense. And the next question is, like, how did you go about learning more about the economic development side of things to be most effective in your role?
Right. I mean, I'm reaching out to networks, webinars, talking with people that were in the roles in the past. So it's definitely just trying to soak in as much information as I can by attending meetings and, just talking with folks in the field.
Okay, that makes a lot of sense. Just various ways of just absorbing new information or getting those connections and networks. And then the last question I had was, so you've been able to become a leader in a lot of the work that you have done. How would you say that your leadership has changed, or how have you become a better leader coming into this role and through the experiences that you have had up to this point?
Yeah, and I think, in management, you're always problem solving. And I think the longer you're in managerial roles, the more problems you will see. And so you kind of, when those problems come up again, because they do, it's not unique to different offices. Some of the problems will occur. You become better by learning from your past experiences and solving the same problem.
Awesome advice. Awesome advice. And get great insights for future leaders out there. And just knowing that a lot of the issues are going to come up and they're going to come up again. And it's really focusing on what have you taken away from the last time to improve and iterate to have a better solution to the issue this time. Okay, so before I move you on to the last section of the show, I would like to ask, where would you like to see yourself in the future?
So the right answer is Loyola University. But I think I'll always be doing work with community, and I don't know in what shape or form, but I don't see myself not working with community stakeholders. It's just something that's always been there, and I think always will be there.
Okay, awesome. And we look forward to seeing how that turns out and how your role continues to expand in the work that you get to do.
Mm.
And last but not least, moving you on to the Furious Five, with 5 questions I ask all guests. Number one, what advice would you give to a student trying to pursue a career in public health?
So I would say, don't feel locked into a particular discipline or research topic. So if you're studying maternal child health now and you get out and you see a fabulous opportunity in, public health policy, just do it. Don't feel like, I have to stay true to what I did in my grad programs. Public health translates in a lot of areas. So if you feel like, oh, my interests have changed, don't feel obligated to stay in the same path because your degree program or your research was in a particular area.
That is actually very, very good advice, and I think a lot of people they limit themselves with that without having that type of perspective. So I appreciate you sharing that. Number two, if you were talking to someone wanting to get into your position as an executive director, what advice would you give them?
So again, university community engagement can be a niche industry, but a lot of people do apply for those jobs coming out of the nonprofit sector. A lot of our work feels very similar to the work nonprofits do versus academic departments because it's community focused. So if you've worked at a nonprofit and you're really ready to transition to an academic setting, but you don't want to be a faculty member, but you want to work with community, it could be a good field for you. If you're already on a college campus, seek out these offices. They have them, most universities have them at this point. They're just called something different. Sometimes they're called the Office of Community Engagement. Sometimes they're called the Community Volunteer Center. So just figure out what it's called and seek those people out. They're usually, student development professionals are always willing to connect with students.
Awesome. Number three, what's something you are working on improving in your life right now?
So I would say as I take yet another community-based role, as I'm learning to say no to um, evening and weekend things. So in community engagement work, there will always be a charity event, there will always be a community association meeting. And I kind of put a limit on how many of those I do in a week. So if I've already committed to 2 evening events, I will decline the third and fourth. That is, I don't know if it's I'm getting older, what, but younger me would have gone to all the events, I would have done all of them. And now I have really no problem saying no to some of them. You just have to regulate yourself.
Yeah, that's awesome. Maturity and your boundaries is important. That's for sure. Number four, professionally, do you recommend anything?
So professionally, so actually this is more about work-life balance. So during the pandemic, I came across a Black female yogi called Ariana Elizabeth. She's on YouTube. It's a very good channel. I don't know if you know.
Yeah.
Yeah,
Yeah, no shades.
amazing. Amazing. And I it was during lockdown. I think I just Googled Black female. Yeah, yeah, I don't
Yoga.
know how I found her.
Yeah.
But the catalog of videos is amazing, all skill levels, parts of your body, like if you want to focus on your core. She also has a spiritual element, so highly recommend it. She's very popular. I see she has a big following, and I think she's trying to get a permanent studio.
Yeah, I'm absolutely very familiar with her. Also picks up yoga during the pandemic, and she is one of the people that definitely go to, especially in the space of Black yogis, which I think is
Mhm.
important. So yeah, I'll definitely add that to the show notes for everyone to check her out. And you could also join us because we actually do yoga every Tuesday and Thursday, 8 to 8:30.
Okay.
If you join the Discord group, you can get a link in there, and you can join that group by going to thephmillennial.com/join and see you there. We also had some meditation, like a community guided meditation.
Oh, that's
That's
great.
good. That's going to happen as well. So if anyone is interested, join there, and there's a link in the description for that as well. But I appreciate you sharing that. And then last but not least, where can people connect with you?
So I'm very accessible on LinkedIn. You can in message me. I'll respond.
Awesome. Well, I appreciate that, and I'll put your link to your LinkedIn in the description and the show notes for anyone who's interested in reaching out. Greatly, greatly appreciate you coming on here, Dr. Gia Grier McGinnis, and sharing your insights and your story. I definitely found it insightful, and I hope that others do as well. So thank you again.
Thank you.
Truly, truly is my pleasure. So housekeeping items, everyone. Thank you so much for watching or listening to this. Be sure to subscribe if you've not subscribed as yet. Leave a like, leave a 5-star review, and share it with a friend. I will see you all next week, or you will see me next week, I should say.